I'm Dentist Reema from GuruNanda team. How often should you replace your toothbrush? Let's talk about this. Your toothbrush is your first defense against plaque, bacteria, and gum disease. However, over time, it wears out, collects bacteria, and becomes less effective. Using an old toothbrush can lead to poor oral hygiene and increase the risk of cavities, gum infections, and bed breath. So, when and why you should replace your toothbrush? As a dentist, I recommend my patient to replace your toothbrush after every 3 to 4 months because the bristles become less effective at cleaning teeth. Worn-out bristles do not remove plaque and bacteria properly, increasing the risk of cavities and gum disease. If the bristles look spread out, frayed, or bent, it's time for a new brush, even if it has not been 3 months yet. Damaged bristles are too soft or stiff and can either fail to clean or harm your gums. Even after illness like flu, cold, it is best to replace your toothbrush as bacteria and viruses can linger on your toothbrush. If your toothbrush has dark spots, a musty smell, or any unusual buildup, it could be growing mold or bacteria. This often happens if it is stored in a humid environment without proper drying, so you should replace your toothbrush. If you have had oral surgery, gum treatment, or dental work like braces or crowns, I as a dentist recommend my patient changing your toothbrush more frequently. This helps maintain hygiene and prevents bacteria buildup. Kids tend to bite or chew on their toothbrushes, causing bristles to wear out faster. Parents should check and replace children's toothbrushes more often, sometimes every 1 to 2 months. If you use an electric toothbrush, replace the brush head every 3 months or sooner if the bristles are worn out. Store it upright and allow it to air dry. Don't share toothbrushes with anyone, even family members, as it can spread germs. So, replace your toothbrush every 3 to 4 months or sooner if the bristles are frayed. A fresh brush keeps your teeth clean and healthy. Thank you.